There's not a lot of us today. Yeah, I would bet Kip's been going because.
Okay, it is 1:35, we have quorum, so we'll go ahead and get the meeting called to order. Welcome everyone to the first Providers Council meeting of 2025. Let's go ahead and start off with the roll call attendance.
Kevin Moran,
Here.
April Lott,
Here.
Barry, Dolores Rocco, Erica Jett,
Here.
Steve Blank, Steve's online. Lariana Forsythe.
She's not here, but I'm here on behalf of Laura.
Okay. Lieutenant Zach Page
I'm here online.
is online. Michael Gelaza,
Here.
Mickey Thompson,
Here.
Christine Long,
Here.
Judith Warren,
Present.
Andy Cole.
Here.
Online, okay. We do have a quorum, we have 8.
And we have quorum in the room, but I guess to clarify order of rule on voting, we have action items. Possible action item. Voting is only in room, not online.
According, yes, yeah.
All right, next on the is the consent agenda. April.
Motion to approve the consent agenda.
Second.
All those in favor say
We
aye.
have a motion, who is the motion?
I did, and Michael seconded.
Okay, got it. All in favor, say aye.
Aye.
Any opposed? Motion passed. Okay, moving into increasing RRH mitigation fund payout. This is a possible action item. April.
So I think this is a follow-up from our last maybe Providers Funders Council meeting. I asked that we be willing to look at this. So we established this fund to encourage our landlords who we at the time were hearing were reluctant perhaps to rent to individuals who had prior histories of evictions and other things for fear that their property would not be cared for and that kind of thing. And so a risk mitigation fund was established. It was reported last Providers Council, I believe, by the HLA, Victoria, or somebody who, really talked about that we haven't had a lot of claims. In fact, you can see up there, we've had a total of 3, and that the maximum amount of claim currently is we've set at $500. I think we did that originally because we were fearful that there might be too much, right? That the claims might come in at, $10, $12, $14,000 and we wouldn't have enough money. And so I just wanted us to look at it. I think that the history has suggested that we might be able to go up a little bit in what a maximum claim could be. And I would just like to have that discussion. I think at a maximum of $500 that we probably are not getting additional landlords as a result of a risk mitigation fund, if that makes sense. I think if they're going to be willing to work with us, it probably has nothing to do with a risk mitigation fund if the maximum is $500. So I would just like to have the discussion here because we have the funding. We could always come back and address it later. But my thing is that perhaps the maximum claim I would like to recommend is somewhere in the neighborhood of $2,500. I know that would be a large jump, but it would seem to me to be something that landlords who aren't otherwise engaged with us would be willing to say, that's a sufficient amount of money if there were damage to my property. What are the thoughts of the rest of you?
I would agree. I think that we run into quite a few issues that you've well articulated around recruitment of landlords, so I would agree.
I would agree too, but my question is we've had 3 clients, 3 claims. Since when? Like, was this in October 1st? Was this in July 1st?
I think it's been
Ever.
since the inception of,
2018.
I think it's been since the inception of.
Since 2018.
Yeah.
6 years.
Yeah.
Yeah, I think that.
I feel like there's more that we're handling internally.
Yeah.
Do you agree?
I do agree that we're
Yeah.
handling them internally, and this was not intended necessarily to replace those of us who can handle things internally. I think it was really intended to be, just like I said, that we would be using this as a strategy to recruit or to kind of tip the landlord that's a little reluctant, but to tip them over the edge, so to speak, to say, okay, if there's a risk mitigation fund and damage is done to my property, that there's a way for me to, have that addressed, or with some financial assistance or financial support. And the process is pretty simple, quite frankly. So as you can see, it's not being used. I don't think it's being used because I don't think we're using it. I don't think we're using the words to get landlords. I don't think we're telling landlords about the risk mitigation fund.
I would agree with the need for the increase. But I have 2 questions around it. One is, do we feel people are adequately aware of it? Have we marketed it? Have we educated those that could access it, making them aware of it? So that's the first part. And so if we increase it and then we marketed it, then we could get back to the reason we kept it so low to begin with, that there's more than we could handle and manage. And so then the second part is, what will be our, so assuming we move forward with an increase, what will be our process for prioritization, or, will be first come, first serve? How will we structure policy and procedure around access to the funds, should the funds deplete or get close to depleting? Or there be more demand for it than we have?
I mean, I think it's a risk that we should be willing to take. I do think that could potentially happen, and that was the fear to begin with, by the way, which is why I think it was set at $500, was that there would be this, overutilization request need for it or something. It's probably wrong for me to say it would be a good problem to have, but it seems to me like if we have all these landlords who are now willing to rent to people who otherwise have, histories that aren't great, and they're doing it because we have a risk mitigation fund, it seems to me like it's a good problem to have, and I bet we could raise funding. Do you know where the funding came from originally, Victoria? Was it the county?
I'll be honest with you, I don't know. Alex, you're online, do you happen to know?
Pinellas Community Foundation.
Yes, okay, Pinellas Community Foundation, right? So I would argue that, yes.
Could go back.
I think if it depletes, that we would have an argument, right, in a case to make, a business case to make, that we needed more of those dollars.
Can I add, because I think it's relevant, the Funders Council this morning, I talked about landlord recruitment, including landlord incentives, and possible, not a really in-depth conversation about funding streams, but about looking at funding streams to increase landlord incentives and creating a work group to identify those with housing specialists and landlord liaisons. So I do think that that's really relevant to what you're talking about, that was a topic of conversation this morning as well.
Yeah, I agree.
We also incentivize some of our positions with recruiting landlords, so. Any new landlords that are recruited and used first time they get in, bonus. If they're used again, I can't remember how many, I think it's 1 year later, there's another small bonus.
Yeah, that's cool. And is it still accurate, Victoria, that we have somebody, a staff member of the HLA who's also doing landlord recruitment, and
I believe that's how landlord liaison.
yeah, and so, that would be where, kind of the education, and I'm assuming that person is already using risk mitigation fund language when she's talking to new potential landlords, right? But at $500, it wouldn't be, I'm just gonna say, it wouldn't be a whole lot of incentive for me if I was like, just not into it. And if I was into it, I wouldn't need the $500, you know what I mean? It just doesn't seem, but anyway, so.
Aaron does have his hand up.
Okay, Aaron?
Yeah, and I think it's important to note it's beyond the security deposit. So the conversation with the landlord is, let's say the security deposit is $2,000. Now you're protected up to $4,500 of damage. That is very powerful, instead of 2,500. And I think April's valuation is important to increase it substantial enough to now that pitch is materially different because it's the security deposit plus this amount. And that is so important as a selling pitch, I think. And if it does, have the spend down, at least the process right now is first come, first serve, how we accept the applications, and that's how we process them. Thank you.
Clarification. All right, well, sounds like there's some mutual agreement on this, so I stand for maybe a motion from the floor to increase the risk mitigation fund maximum claim amount from $500 to $2,500.
Motion to approve.
Second.
Motion and a second. All in favor, say aye.
Aye.
Any opposed? Motion passed. Thank you. I think that will be a huge improvement for the use of these funds moving forward. Okay, moving on to the next topic, which is the DCF Challenge Grant. We don't have a lot to update here, but since it was on the previous agenda, we wanted to keep it on here to kind of give you where we're at with this. I can start with you, Aaron, and I know the executive committee is still in discussions about this and how we are going to get these funds spent in the short timeline that we have.
Yeah, that's the same update from the HLA, just the spend is by June 30th and our update is the same. So that's where we're at. Thank you.
What I would say to this is that these funds came down at a kind of an awkward time because we were in the middle of 2 hurricanes and a variety of things that were, distracting all of us. In any case, these funds it's about $300,000. It is that very, very specific to the what is commonly referred to as the no camping bill and are, kind of very specific to being able to either increase capacity from an emergency shelter kind of standpoint, or a non-congregate emergency shelter is really what they're interested in, and mental health and a variety of other things. In any case, the executive committee is taking a look at it. We have a short amount of time to get this out. One thing that we are currently considering is there a way to add any funds to a current contract with HLA, as opposed to going through a very lengthy or time-consuming competitive bid process. They are one-time funds, they're not replenishable, that kind of stuff. So in any case, the executive committee is looking at it, taking it, it has our attention, and we'll be getting back with the HLA, and we'll be able to provide an update soon.
Any other questions on that or comments on that?
Happy to take money.
I looked at that, I looked at that quite closely, actually, Judith, and what I will say to you is one of the reasons why that it doesn't look like it's a viable option for us to do that with St. Vincent de Paul is because you guys are not spending the current challenge grant funds. And so I don't know on record, that's what it looks like.
Yeah.
So I don't know.
I can give you an update.
Okay, it might be that you guys are holding invoices and we haven't submitted
Yeah.
the invoices yet, kind of thing, but what I would encourage you to do,
Yeah.
because if that is truly an option, we might want to consider that.
Sure thing.
Is if you guys are holding invoices, or if more of your current challenge grant funds have actually been spent than what it looks like, that could be an option. But right now, on paper, it looks like you guys aren't going to spend that.
I'll take a look at it.
So I have an update on that too. The report I sent April, their November billing hadn't come in yet. They have since billed 2 invoices that have have been spent. So it's coming through, yes. So some of
Okay,
it
good.
has
That's
processed.
wonderful information. Thank you, Aaron, and thank you, Judith.
Yes.
So that might in fact be an option, right, that we could, so we will take that back and look at that, right?
I can give an updated report if you'd like, April.
Yeah, would you please, Aaron? Thank you.
Yes.
Okay, a review of emergency shelter written standards. I guess before we get into this, since there was funders council already this morning, was this on their agenda as well? It's not.
No, it was not.
Because this item in particular, not that providers don't, we are overdue to review these written standards. We have not done this in quite some time, but it has particularly been brought to attention by funders to have this reviewed. And so since it really needs to be reviewed by providers, it needs to be reviewed by funders. I'm not certain if there's specific things that the funders are wanting to add or change or as it relates to these standards. But it has been brought to my attention prior to several providers council meetings, when are we getting this on the agenda? And we've had other hot button items in recent meetings that it has not gotten to the agenda. So I have agreed to have it on here for discussion or review because it is overdue. So it is in your packet, I think starting on page 38. It's a
On the screen up there on the margin.
Yeah, I don't think I have that.
One full copy is very large, so it's print out everyone.
Maybe for anybody that can't see it there.
Yeah.
So it is our responsibility to review this. Do we need or make any changes given things that are going on currently, especially as it maybe relates to the no camping laws, those aspects. And then ultimately it's gonna, need to get brought to the joint provider funders council, and if any changes or no changes are made, would be brought to the full board for that it's been reviewed and here's the changes, or it stays the same, and get it on the record as having been reviewed and approved.
Is Sherry online?
No, Sherry's out with the same stomach virus that kept me home today, so I'm going to fill in for her.
Oh,
April.
okay. Yeah,
Thank
because I think Sherry had some information, correct? Like around changes or around just the standards as they sit now.
Yeah, so what the process, it can be twofold. One is we can take feedback from any of the providers who, do emergency shelters, who have their own standards, of course, that they meet. And if there's any conflicts between their standards and our CoC, broader Florida 502 standards, those conflicts get discussed here, and any changes, we match them or not. And those get to the full board, and that's reviewed, and now we have 2025 standards. Best practices from the HLA, one of the things that we are now being told from CoC is that our recommendation as a lead agency is, because of the current atmosphere, we need to make sure no written standards are referencing anything related to DEI, anything related to refugees. We want to be very, very clean. And again, I'm going to say, unfortunately, with how we're talking about our standards. Now, whether it says any of that specifically or not, that's what we're being told for best practices with any standards published or not, certainly with these written standards. As far as what they are, these do not materially depart from current HUD written standards as far as emergency shelter. So unless there are major concerns from anyone within this community, these can be reviewed. Again, absent the DEI, the refugee shelters, that, type of language that we would be fearful of federal funding loss. Those changes absent, our recommendation would be, unless specific providers have any conflicts, the board could move forward with these, and then we've done our review for 2025.
For the room, right, when we establish these written standards, for many of us, what you'll remember, I'm looking at Michael and Mickey in particular, but years ago, we had a variety of what I'm going to call emergency shelters being operated by entities who were outside of the CoC and weren't a part of the CoC, and there was lots of comment on the street that these shelters were deplorable. They were unfit, right? We had 4 people in 1 bedroom. We're taking full paychecks. We're disability checks. I mean, there was some impetus to our written standards, and it's important for everybody to understand that. The other thing that I think is important to understand is that these emergency shelter standards would be being set for all emergency shelters in Pinellas County, and not just those who are attached to, for example, CoC, or attached to HUD dollars, or attached to, as we know, right, our NOFO doesn't even fund emergency shelters. So it's important that we understand how these rules, how these standards would be used. It is my understanding, I'm looking at you, Victoria, because I can't really see Aaron, but the thing is that our funders have brought this issue forward to say they are looking for very specific things around what they want to fund in an emergency shelter, or what they don't want to fund in an emergency shelter.
One of the things that I have heard, and I want to speak for funders, which is why I was curious whether it was on their agenda, was access, right? They're not satisfied with the access to shelter, in general. And
So many of our emergency shelters operate, for example, the only way in is on a Tuesday, right? You got to be there at 5:30 in the morning to get into the queue, so to speak, and then they start taking at 7 o'clock, and from 7 to 8 or something, you got to be there in order to get into the emergency. These are the types of things, right, that we're talking about. So I just want to make sure when Aaron's talking that we're all talking about the same thing, because I'm really not talking about the real issues and the real things that we're trying to talk about here. But
Yeah.
so it came from our funders who have expressed concerns about providing what I'm going to call local funding, right. To emergency shelters, because those requests are coming to our local municipalities, and they're looking for emergency shelter standards that have been vetted and approved by the CoC, that those emergency shelters would operate by. And so I don't know, that's why I was looking for Sherry, or if you're able to talk to it, it's like, so what are we changing in our standards relative to access, right? Like, do they have to operate 7 days a week? Is there have to be a process for which you could get in it at 2 o'clock in the morning? Is there a way to, are we looking at that kind of thing in these standards?
Well, so this is, now I guess we're confused too, why that wasn't on their agenda when we asked what they wanted on their agenda. We assumed, since Kevin asked it to be on the provider's agenda, that providers had feedback that they wanted updated as far as these standards. So we need to hear about access. So we need to know specifically from the funders what is missing from these, so that we can update. So it's not a best practice national HUD guideline issue. It's a local issue, right? So we need to hear and have this discussion with them, right?
And probably what the funders would respond to in this conversation, they were saying, well, are you as providers in general as well satisfied and happy with the access to emergency shelter in your community? So they're looking for us to review, make recommendations for them to also review, and then it'd be sort of a collaborative joint decision and discussion.
So if hours or such is looking to be included in here. You know, at first contact, we're open 24 hours a day. We get these calls and the calls offloaded to us, folks looking for shelter. You know, want to throw out maybe starting at I'll just throw it out there, a minimum number of hours during regular business week, Monday through Friday, whether it be 8 hours a day for access, because as a shelter, you're an access point. My understanding, you also do screening at those shelters. So even if you don't have space, they're getting sent into us. They aren't being screened for that screen to get in there. So the access is to talk with people, whether you have the space or not. So I'll throw out there 8 hours a day, Monday through Friday at a minimum. And then, you know, because I'm cognizant of the weekend piece and after hours. I know that's a stretch for some centers. But they could set that 8 hours, whether they start that 8 hours at 6 in the morning or they started at noon or, you know, for that. So I'll just throw that out there because what happens is they come back to us, they never get in to HMIS because again, those shelters are screening points. It's not just staying there, they're screening points to get on the list.
And when you say screening, you mean the VI-SPDAT.
Correct.
You mean the vulnerability index,
Correct.
right, that has to be done in order to get on the list.
So that's a shelter standard. You must do the VI-SPDAT at your
Right.
shelter. Is that on there?
And so maybe one of the ideas is a joint, like a work group with some funders and providers together to understand, are we talking the same language? So that then we as the HLA understand what we're going to research. So if access standards are one of the things the funders are looking for, then we can help guide those standards with certain providers. But I don't know what those concerns are, you know, access now being one of them, and we can help, you know, because it's really difficult to then make a standard if not all of our even providers who are on, you know, in the CoC can meet it. You know what I mean? So we kind of have to start from what are the concerns topically and then work from there. And maybe a joint work group is how we start, or today talk from the provider's perspective and get it on the next agenda with the funders.
Yeah, I would agree with the work group that, you know, one or two of the Funders Council and one or two or so of the Providers Council, and of course, being sensitive to having, you know, somebody who's representing emergency shelters, in particular, representing Pinellas Hope. You know, I think Pinellas Hope's voice will be invaluable in hearing what their barriers are relative to access. I'm assuming it's going to be you know, staffing related, although I don't know that for certain. So I would agree with that.
So I would just say, having worked for a funder is, you know, when you look at childcare or foster care, there's concrete standards that are very prescriptive, right? And so because that doesn't exist those regs don't exist rigorously, if you will, in any code, administrative code, then I think sometimes the funders feel like they don't know what the standards should be, like by way of, like I even look up here, it says adequate bathrooms. So from the funder standpoint, I remember people saying, well, what does that mean? One bathroom to every 5 people? Like what specifically does that mean? Now, being on the provider side, you know, we also don't want to make standards that are so rigorous we can't operate. So I think there has to be a middle ground. I like the idea of a worker.
And as
Yeah.
the HLA, as the lead agency, kind of best practices is to write your policies that way, because adequate bathroom that's almost how it has to be written across the spectrum of your providers, because adequate bathroom to one provider is going to mean very different. And so almost your CoC broad policy has to say that. But yeah, the topics, you know, have to be a joint work group. And it's very challenging as a funder then to say, yeah, well, what does that mean? But It has to mean that. So you're right. It's a very difficult process, but we wanted to say what we needed to say for the funders in particular.
But doesn't the coordinated, our coordinated intake policies and things that we have for that say in there, the shelters are screening points?
Yes, shelters are access.
So
points.
anything that's in there should be reflected in here as a shelter standard. With the screening being done in the. I just, if whatever work group, if I'm able to be a part of it or not, if that message could carry through, because that then is consistent. Of your coordinated entry is saying, yes, they are gonna do the screenings. Yet they're not doing that.
So give me an example, because I want to better understand what you're saying, Nikki. If somebody calls, then they're just told that there's no beds and they're not being screened, is that?
So say a family with minor children shows up to a shelter directly. And that shelter's not doing access, at that time, because they only are an hour a week to do that. That person then is told to call 211. They may, or, to us, they may make that call, they may not. And right now, then we will screen them to be screened, to get an appointment to be screened. So we're screening and screening again for a family with minor children for that. So that's the one particular example with that really puts a barrier of, and we're not counting as many families if we can't get them screened. And if they show up to your shelter, they're homeless at that point, they should be, screened. So agreed.
To answer your earlier question, Mickey, you had asked if hours were included in the shelter standards. They are not. Intake hours are not part of the written
Right, I
standards.
was just throwing out there.
Does this, is the
Right.
screening though, right? Because
No.
again, there's history to everything, right? So just because there's new faces in the room
Right.
and new places online, right? The history sometimes is important. So the VI-SPDAT, right, which is the vulnerability index, which is required for just about everything in terms of an entry point, right? There was a time when we trained every Tom, Dick, and Harry to do
All
the
the shelters.
VI-SPDAT.
All the shelters.
All shelters, street outreach, every Tom, Dick, and Harry was,
And the scoring was.
and the
off.
scoring was off, the iterator reliability became an issue. Someone would get screened by, someone from Directions for Living, and they've got one number, they get the screening, by somebody else at 211, they got a different number, there was an iterator reliability issue. And so we narrowed then who was going to be trained in order to increase the iterator reliability and the validity of the VI-SPDAT score. We narrowed that, and in the narrowing of that, one of the outcomes of that was that all emergency shelters would in fact be a screening point, is what Nikki is talking about. So the question is it in coordinated entry policy that if you go into shelter or you go to shelter, that within 3 days, I think it was within 3 days or something, that they had to have a VI-SPDAT?
I want to say yes, but I'm not the coordinated entry manager and I don't have those policies right in front of me, so I'm not going to say definitively yes. I will, however, say that I just reread the shelter policies in the written standards, and the VI-SPDAT is not specifically mentioned in the shelter section.
Okay, so that would be an issue, because I think it is in coordinated entry.
That's what I'm saying. It would be aligned.
Yeah, and so we would want there to be, kind of correlating language in both policies. Again, emergency shelter policies are for more than those emergency shelters that are attached to the CoC. And in any case, so we would need to look at that, but we changed I think it's within 3 days that the VI-SPDAT has to be done. But what Mickey's point is that if they're not being admitted, but they nonetheless have presented to an emergency shelter, should it be in written standards that the emergency shelter is in fact required to do the VI-SPDAT? Just to get them moving.
Well, from a data standpoint and to get them on the list. Yeah, they're undercounted,
And I think.
which has always been our
And I think
issue
that-
with families with minor children.
And I think the funder's perspective on it is we don't want to fund someone that's not helping to facilitate movement through access to the shelter.
I would just say that the VI SPDAT in itself is kind of going out of favor, and you know, there's going to be a lot of changes around recommendations going forward. So I think that these procedures should reflect back probably to the HLA policies. They're following,
Whatever that,
HLA
whatever that
guidelines.
assessment screening.
yes, assessment screenings
Makes it
as
change.
prescribed by the.
Oh, the
HLA.
48 entry.
Those types of things, rather than getting specific, I think we need to just refer all of that back to.
Well, that would require a find and replace in about 700 documents, right? So because VI SPDAT language is in fact currently used in every single policy that we currently have. So what I would say
Except for
is
this.
that,
That's this one.
right, is that we, yes, we are aware that there is language and there's controversy around VI SPDATs, and that, in fact, we had a committee in whatnot who was working on making recommendations relative to a new screening tool that would be adopted. And so I think it's a point well made, right, about, you know, using language like screening tools as opposed to the specific screening tool. But I don't know that we can take that whole thing on right now, because we do use the SPDAT language in so many of the policies. But nonetheless, I think a work group of having two or three or as many people as who wants to be a part of the the written standards, but I think funders have to be there because they've expressed their concerns.
And if we could do that work group prior to the next joint provider funders council meeting, that would be ideal.
And Kevin and April, I would ask, would it be good to have it broader than just emergency shelter subsection of the written standards? Or just focus on this section for now? Because the charter says all of it should be reviewed. And it may be helpful if there are concerns about other sections. Or we focus on this.
I think we should start with emergency shelter written standards, Aaron. Very specific to the emergency shelter. Like there's street outreach written standards. I mean, there's just
Right.
so many other ones. But if we started with, it's kind of a big
Yeah.
bite.
Sure. Okay, that sounds great.
Hey, it's Zach. Before we move on, can somebody just make sure I get put on that committee? There's something that hasn't been hit, and that emergency shelter is emergency shelter for adults, and then there's emergency shelter for families, and it's two very different things, because the emergency shelter for families has a 75 person waiting list just to go in. So it's two very different mechanisms on the way things need to be written. So I just want to make sure that that's not getting lost in this translation, and that the VI SPDAT is not administered for emergency shelter adults until 14 days after their admission. So put me on that committee. I'm happy to help work with it.
When's the next joint meeting? A date?
I think it's April 18th. Right. That sounds right. It's my mom's birthday. I remembered that. I looked at it yesterday. April 18th.
So we'll send out an email to, membership or committees this week, or early next week, about who wants to be on the committees for this work group, and get it started as soon as we can.
Sounds great.
Would you like it limited to providers council and funders council right now, or would you like to open it up to other committees like data and system performance, lived experience? We'll schedule like first.
I mean, I think anybody who wants to, I'd love to have people with lived experience, right? Who are entering and who have used and are advocating on behalf of people who are currently using emergency shelter doors. I would think, again, you can't do a lot of work if you have committees in the neighborhood of 50 people, but assuming it would be a manageable number of people who want to participate, I think it should be as many people who want to have a voice in the standard should be invited.
I need someone that's gonna lead that work too. It's not gonna be me.
Thank you.
Is anyone on this call, like Lieutenant, willing to lead the work group, so I can at least say in the first communication we have a leader? That would be helpful.
I am not willing to take that on, but I will happily work with it.
I hear you.
What would you see the role as the leader? Talk to me a little bit about the
All I,
responsibility.
the role of the leader, in my estimation, would be to call to order, and you're gonna have the version. You're gonna be version control master. You are the one who's gonna be in charge of the document itself until we bring it back to the committee. That's what I want.
It should be someone knowledgeable
I'll do it.
of the document.
Yeah,
Thank you. Yeah, I'm willing to.
Wonderful.
I don't know who that is, but Victoria or Megan, please take that down. I can't see. Thank you so much for who volunteered. That's wonderful.
Thank you.
Wonderful.
Julie.
Yes, thank you.
Okay, so we will cast the meeting wide. Judith will lead it, and we'll try and get something scheduled. You know, obviously preferably before the April meeting, so that at least, it may be that the work group can't get a finished product by the next joint funders council meeting, but I think at least at minimum, be able to at that meeting, be able to report that we have an active process in place, group in place, getting some thorough review and changes made.
Sounds good. Thank you all for the
All right,
guidance.
thank you, everyone. Yeah, shorter than I thought.
That's good, because I think it's never.
Yeah, all right, so let's move into the, we do have a couple things that didn't make it to the agenda to talk about, but let's go through the point in time overview and impressions, and this is, this is really for everyone, but Victoria is going to lead us through as far as some of the data and experience for the day, but then open to everyone here's experience and perceptions as well, so that we can add that on the list for improvements, trends. All right, Victoria.
So everybody, of course, knows that the point in time counter kit provides HUD with a snapshot of homelessness in our community. This year's point in time count was January 30th. And we had 307 volunteers deployed this year. That was less than last year. We had 396 volunteers out there doing surveys last year in 2024, 307 this year. Of course, volunteer recruitment and everything was pushed back because of the hurricanes. Volunteer recruitment did not start until very, very early December for this very late January event. So it was a little bit strange this year because of that. But with those 307 volunteers, we were still able to complete only 61 less surveys than we did in 2024. So of course, we're still cleaning the data. There are still duplicates in there, so I'm not ready to give everybody those final numbers yet. But it was only 61 less surveys in 2025 as compared to 2024. We also, of course, just so everybody knows, we'll have the results available in the summer. So board of directors will approve the final report, hopefully in May, but at least by the July meeting. So that's that information so that you have it. Also some feedback that we got this year. So the app that we used this year was, once we got through volunteer registration, pretty user friendly. People were pretty happy about that. We're also really excited because on the back end, it gave us more functionality, and the dashboard that we're going to release this year will be even more interactive than last year's was. So we're moving in a good direction that way. Also, it allowed us on the back end to actually watch where people were, see how many surveys people were doing so that we could redeploy people if they were in an area that maybe wasn't getting any action. So those were some really cool additions this year over last year. We also increased flexible training this year. So if you were repeat volunteer, you got to do some self-paced training, and We're always trying to improve that process. If you have feedback, please let me know. Opportunities for enhancement that were identified, improving volunteer registration. We used a new system this year that we are going to work to improve next year because it was funky this year, I'll just say. So we're excited about improving that for next year. There was a request to create additional materials for how to approach people. So one of the ideas that I'm going to be working on is creating a little video off season that we can just share with people, and you can watch this on your own time. So if you've done PIT 20 times, you don't have to watch this video, but if it's your first time or if you're uncomfortable, you can watch this video and see a few different approaches. Also, we are going to work on improving an internal workflow so that there's a better process for deployment center check-in. And we're now actually digitally checking our volunteers in, brand new thing we did this year. Again, it really improves things on the back end, but it does mean that we do have to create new workflows for these new processes now that we've tried it all out once. So those were the identified successes and opportunities for enhancements, really. There was some mixed feedback on the switch from bus passes to gift cards. That was a decision of the PIT planning committee because bus passes are really not an incentive in South Pinellas anymore, or at least not in the city of St. Petersburg. And in 2024's PIT, there was even a report of a lot of folks in South Pinellas saying, no, I'll do the survey, but I don't actually want the bus pass, you can keep that. So we moved to gift cards this year, seemed to be appreciated in South Pinellas, but in North Pinellas, there was definitely some feedback about, hey, where the bus passes go, we want the bus passes. So that'll be a conversation we have in future to figure out what to do for next year. And then there were a couple of areas of concerns noted. These were really surrounding the anti-camping law. Volunteers reported a number of people refusing to do the surveys. Volunteers who have done this year after year reported more people saying, no, I will not do the survey this year than in years past. Some people specifically said, no, I will not do the survey because of that new anti-camping law, or, alluded to it in some way. There was at least one report of a family that said, no, I will not do your survey because I'm afraid of ICE. And that is definitely a point of concern and is something that we'll have to figure out how to address before next year's count. I unfortunately don't have numbers of refusals because some of them are tracked in the system. They say no, but we've already opened it up. So you say no, and that's tracked in the system. But folks that they just walked up to and said, hey, do you want to do a survey? And volunteers didn't put that into the app. We don't have that. So another thing we're going to look at for data tracking for next year.
Maybe on that one, I was wondering if there's I don't know the software, what its capability of, but just a simply refusal button. So I think if we're able to find a quick way to do that, we might have a little bit more accuracy around that point than having to go through all the things to get to a refusal.
Yeah, I think so. I think that there's probably an easy way, even if it's just like a little separate button that you push and you just hit yes, yes, definitely. And I do this year, I think he's really made it obvious that's an important data point to be tracking that we haven't been tracking so far, at least not really. So those were some of the feedbacks or some of the feedback that we got surrounding issues. There was also reports from folks in North Pinellas. Multiple volunteers reported being interrupted during surveys by police officers during daylight hours who said, once you're done with this survey, you need to go, you cannot hang out here. And that is new. That is not something that happened in years past, but it was something that happened this year. So
Is that at night or?
those were prime daylight hours, middle of the afternoon.
It's interesting that some of this came up with at directions for living in an all-team meeting, because of the numbers of volunteers who have participated year over year from directions for living in the PIT count. And so for them, it was actually very noteworthy. So I'm so grateful to hear your perspective on it, because it was noteworthy for them that year over year, they had not seen and or heard, and so they were reporting, in fact, as late as even this morning in a meeting, that that people were visibly concerned and uncomfortable, had a lot of fears around, and I think it's fair, right? I think it's fair, even though it's incorrect, and we don't have anything that would suggest that any of those fears will come true or have come true. But the fears being, right, I don't know where this data is going. I don't know who has access to this data. One team member said that several actually individuals that they approached to interview said things like, listen, if the police can get this data, they might pick me up and arrest me. Believing that the data would be accessible and how it was going to be used, right? And despite them saying, no, that's not how it would ever be used, and nobody would be accessing it that way, kind of thing. It was like, nope, no can do, right? And that they had not heard that before. And so I do think, I know that predominantly our law enforcement partners in some of our street outreach teams as well have been educating on the no camping bill and those kinds of things. I just wonder if there's some twist that needs to be added to the education, which is, because I'm fearing, right, VI spagats, for example, so moving away from Pitt, that people might not be willing to even participate in, right, a screening tool, whatever screening tool it is, for fear that the screening tool could also be used to harm them in some way. So, I'm just wondering if some twist, and I don't know what that would be, but what, that we could be educating people on the streets that, these tools are not developed, designed, and have never been used to harm the individuals that we're trying to serve.
Maybe we could consider some language in the intro the disclaimer notice that we say that we specifically address that. I know it's a bigger issue than just the point in time, but for some of our volunteers that maybe are not as versed in this and up to speed, at least having some language in there that they are reading out that reinforces or reiterates that piece, I think could be worth adding. I'm not sure.
Yeah, I think that was on Amish.
Hey, one of the things that we haven't done in years past is, and not to my knowledge anyway, is educate other, there's 20 deputies or 20 officers from maybe each of the larger agencies going out and helping with Pitt every year. I think those are the only officers and deputies that it's communicated to. So maybe for the future, we need to communicate that to all deputies, because what April was talking about is concerning, is that, people getting interrupted in the middle of that. That's not kosher, right? So what we can do is, and I can only speak for the sheriff's office, is that what we can do is for the next year's Pitt, at least, is we'll put it out we'll put it out countywide and just say, hey, this is the Pitt count. It's going on. It happens every year. These things are going to be happening. Leave these people alone, basically, just so that we can help make sure that the surveys can be done, collect the data that we need, and we're not having to rely on the dump button or the refusal button. Let's get the data that we need.
That's an excellent idea, Lieutenant Haish, and I know that you can only really speak for the SO, but I wonder if we couldn't somehow get your assistance with, because I know that a lot of the other law enforcement agencies partnered with the SO on kind of the education campaign. If there would be a way to communicate with the other agencies to kind of do the same thing, because it really did add insult to injury, quite frankly, in North County, where when law enforcement was interrupting, and it really was one agency in particular. It was only one agency to my knowledge. And I'm sure it was not what they intended. I would imagine their leadership would be horrified to know. I would imagine, I don't know that for sure, but you know, I just wonder if we couldn't do something similar with all of the law enforcement agencies, Lieutenant Hayes, about, right, this is a point in time day, like today's not the day. To be telling people to move along when they're getting interviewed.
Right. Yeah. So as long as things kind of got pushed back with the law enforcement training education piece and everything this year, but moving forward, I don't think that's going to be a huge issue. I can communicate that and have that sent up to be put out to Arrested Patrol wide. I know the other law enforcement agencies that participate in street outreach and all these things, Clearwater PD, St. Pete PD. It shouldn't be an issue getting that up. Pinellas Park, Largo. So as long as we can get that out ahead of time, I don't see that being an issue.
Other items?
I wonder, and not just to talk about PIP, but able to talk about your larger point of assessments and everything like that that we do throughout the CoC. Would Providers Council like to host a joint meeting or a work group or something like that with the Lived Experience Committee to talk through some of these issues? Or would a representative from the Providers Council like to come to one of those meetings to, you know, engage in this conversation there?
Yeah, I like that idea, Beth, probably, is that as opposed to full meetings or whatever, but that, you know, somebody from Providers Council to be willing to attend the lead committee meeting and, you know, if it's something, to bring it to their attention if it's not already on their radar, but then for them to be able to help guide us on, you know, what a strategy might be. Because I don't think it's a huge jump. And this is what I said to my own team members this morning even is, you know, I don't think it's a huge jump. I don't think it's paranoid. In other words, I don't think it's diagnosable for people to be like, listen, I don't know where my data is going and I don't know who has access to it. And I'm not giving it to you unless I know where it's going. I don't think that's, you know, I don't think it's an unfounded, I don't think it's a huge leap is what I'm saying, you know, like, and I mean, you hear all the stuff on the news right now and a variety of things about who has access to what and what they're doing. I just don't think it's diagnosable, you know what I mean? Like, so to poo-poo it or to suggest that it's just ridiculous that they would take that position, I think is unfair. And so
Almost think it's remarkable that it wasn't worse.
I think, I do.
I mean, that you were only 60.
Yeah, that we were only
less.
60 surveys.
That is kind of remarkable
80
considering the
less
context of
volunteers.
where we're at.
Yeah, I do. I would certainly be willing, by the way, Victoria, to be a part of, to attend on behalf of Providers Council unless other people wanted to do that. But I certainly would be willing to do it because I am concerned about more of this fear taking root and disrupting other things like whatever assessment tool we'll be using, in this case, the VI-SPDAT or other, you know, other assessment tools that you'll use.
And if you put it in context, we should maybe have more serious discussions this year. Because put it in context of January 20th to January 31st. Now give it a whole year in terms of what enforcement's going to look like out of the administration. I might be a whole lot more scared next year than I was this year to do that. So I do think that that's, I mean, I don't want to sound alarms and be alarmist, but I guess
Depends on how the year goes.
yeah, I really do. And because I think that if you think about it, last year at this time, we didn't know what to expect from the camping laws. And I'm not saying it was much ado about nothing. I'm not even suggesting that. But, you know, by the time we got to a certain point, I think the sheriff's office, working with your staff, working with other staffs to really get the word on the street, so we reacted okay. But I'm thinking, you're a week after the inauguration, you might not be scared a year after the inauguration. And you start seeing some of these movements around the country, it could be a whole lot worse.
And the Lived Experience Committee has, Aaron came and gave a legal update in December about the anti-camping law. Lieutenant Page came and gave a law enforcement update during January's meeting. And then the Lived Experience Committee during this last meeting this month in February finalized a interacting with law enforcement pamphlet that will go to the board of directors for review and approval in March. So if you want to start that conversation, even during the next lived experience meeting, I think that it's really, really timely and really fits into the conversations that have been.
When is that next?
That is the second Thursday monthly. So the next one would be March 13th. And that's at 5:30 p.m. We are at the Pinellas Park Library, 5:30 p.m. to 7 p.m. We can also send Zoom links if needed. We just meet in person for those because that's what the committee voted on.
Any other items from the point in time, Victoria?
I didn't have anything else for today unless you wanted me to pull up AHIR, but otherwise I'll just email that out to everybody afterwards, and that's all I've really got for today.
The only thing I'll add, just from South County perspective, things that I heard from there, and I don't know if it's relevant in the other areas or not, was that there seemed to be a heavy volume in the morning. And we typically know that there's heavy volume in the evening because there's, meals and but during the middle of the day, a lot of the volunteers were just disappointed, if you will, because they weren't people being found out there. And so there was some discussion in the room just about, do we want to look at our volunteer allocation differently, and I'm sure the committee will have further discussions on this, but maybe more volunteers in the morning and in the evening and less in the middle of the day, just to I don't know if there was a similar experience in Mid-County or North County.
There was. There was. And yeah, that's one of the things we're gonna look at for next year is when we update our volunteer registration, there is functionality in that app to allow people to limit it and allow people to, volunteer for more specific areas and more specific times. And so we're gonna play with that a little bit and hopefully improve that for next year, because absolutely that is one of the big things that the committee talked about. We also, the committee is voted to do some awards for folks who really, went above and beyond for point in time. And so that's something that we're going to start doing annually. So be on the lookout for that. You or your staff may receive an award for point in time this year.
I love that, Victoria. I really, really do, because and Dominique is not here, and I don't know if she's online, but I do think Dominique, for example, I just remember feeling that morning like, if things went wrong, right, like somewhere, right, that Dominique had us, and she was going to be out there. So obviously you and Dominique working together, but Dominique in particular on behalf of the county, I really just think goes above and beyond to ensure that Pitt in particular, but other things in general are working very well. And so I hope she'll be a candidate for some award in the very near future, but I do think that it's important to acknowledge her.
I agree wholeheartedly. I think that her work as chair for the last 2 years, especially after so much work at hurricane shelters, because Dominique was at those hurricane shelters and those step down shelters every single day. I really think that it is really noteworthy, really impressive, and I'll be sure to pass that along. Thank you, April.
Okay, does anyone else have any other input, comments, experiences with the point in time? Online? Okay, hearing none, we'll move to really what is our group discussion, but this is also the area where we have some. There's one particular item that April and I have discussed as it relates to HUD. Yesterday, emails were sent regarding the elimination of I think it was 80 was 80, I think it was 80, employees within HUD, two of which are our area representatives, as it relates to HUD, and so we thought it was worthy to bring that up here for discussion. I don't know exactly how we're gonna respond or handle, or exactly what they're going to do, but I think we certainly need to be prepared as providers, having some early discussions around some of those significant changes.
You know, Aaron, I sent you an email. I don't know if you've had a chance to see it, but did anybody at the HLA get that email saying that the HUD TA assistance for our community CoC has lost their job? They didn't use the words lost their job, but is no longer employed, and therefore our technical assistance relative to ESG and other CoC matters, right, might be delayed.
So yes, we got the email. It didn't say delayed. It says technical support will continue. What is not clear is who our current point of contact is. So 80 were, yes, took the resignation, accepted, whatever. And so they haven't yet assigned who are left the overflow. And so funding hasn't stopped. Nothing is stopped with ESG. We just don't know who our TA is yet. And so what has stopped is the monthly one-on-ones with the CEO yet. So right now, a small change, but portends probably big fears and bigger changes in the future.
Right. Exactly, because what the letter said is, you know, for the time being, we're going to try to assume or absorb, right, the work of our colleagues who have been laid off or who have lost their job. We're going to try to absorb the work kind of thing. These are my words. But basically that's what it said, right? You know, we're going to continue to try to provide technical assistance to you in these three areas only, because we're taking on the work of our colleagues who have lost their jobs. So I do think that it is I think we would be naive and perhaps even negligent if we didn't at least have the conversation, right? That there's some pretty big things going on with our new administration that could potentially have an impact on the people that we care so much about, right? In this case, people who are living homeless and or housing unstable. And so, you know, I'm not aware of anything directly yet. Obviously, when the federal funding freeze, you know, went out, I'm assuming that sent fear through everybody in this room, because it would have a significant impact on this work in particular, but most of us who do other work as well, it would have an impact there too. And then it's pulled back, and then it's, you know, released again. So there's some uncertainty and chaos around that, and then getting kind of this technical, you know, just so you know, like you've lost your technical assistance person, but we're going to still try to keep doing all the things that we can do. I mean, there are certain, you know, what I've done at my own organization is like, listen, we cannot swallow the sun. Right. So we're going to have to take one bite at a time here and really pay attention to those things that are important to the work that we do. And there are a handful of executive orders, right, that are important to the work that we do at Directions for Living. And some of that has some significant overlap with the work that we do here that we need to be paying attention to. I will say that, you know, I've reached out to all the people that I would reach out to on leadership on some of these issues. And I have to say that leadership is absent everywhere I've turned. Leadership is absent, up to and including, for example, we just went through our, you know, 22nd or whatever CARF survey, our accreditation survey. You know, our CARF accreditation surveyors on site, and I'm asking them, because there's a lot of language in the standards, back to standards, right, in standards, right, that we are to have policy and that we comply with relative to things like DEI. And, you know, so I say to CARF, right? So I pulled all my policies related to that. I'm like, you're not reviewing me on any such thing because I don't know what I'm allowed to say and what I'm not allowed to say relative to these issues. And what guidance do you have to give me, right? And they're like, we've got none. You know,
They're not scoring.
they're not scoring. They're what they're doing. CARF International's position has been that they would do an NA, so there is no score relative to that. Their largest client is the VA, which I was not aware of. And so they reported, you know, some pretty alarming things that are rolling out with the VA. All of that could have an impact on us, right? So I got notice 2 days ago that they're, you know, Gulf Coast, many of you know Gulf Coast Jewish Community Service, you know, right? They get an email at 11:59 p.m. at night, right? Their funding is shut down. And it was very, very specific to refugees, which people I think confuse with undocumented immigration. Refugees are not undocumented immigration people. And so they lost all their funding. And then several days after that, I get notice that there's, and I'm going to make up the number because I don't remember exactly, but it's a large number, 60, 80 Afghan families from Afghanistan who were very, very helpful and loyal to the U.S. in the war. They then get moved with open arms, I might add. They're vetted, they're not undocumented, they're here legally, in fact. And all the funding that was to support them has been canceled. And so the call that I get was from a church that says they're going to be street homeless. Now, it turns out that that information was incorrect a little bit, and it doesn't look like they're going to be street homeless. But what it does look like is that this group of families, a large group of families, are going to need whatever the fancy words are, subsidies. So they have, let's just say their rent is $1,000 a month. Many of them have 800, but need an additional 200. You know, some of them have 900, need an additional 100. In other words, they need rent subsidies, which is what this funding was providing to them, that they've now lost. And so I just want to know, right, are we, this collective group of CEOs and leaders, right, you know, are we prepared as an entity or as an organization, as a body to begin, like, how would we, if veterans all of a sudden, right, veterans is a priority focus for St. Vincent de Paul. I'm assuming St. Vincent de Paul and others are leading in that conversation, that if they were to lose funding, if they were to lose support or services, right, what would the ask of the community be? And I'm assuming that would come from Michael and others who do some of that work. But for us as well, you know, like, so if all of a sudden we have 60 Afghan families who need rental subsidies, do we need to VI back to them? Do they need, what prevention program do they get attached to? Are they, you know, they are not a group of individuals or families that historically would have come to our attention, and our processes don't really speak to their collective needs, if you will, right? But that shouldn't mean that they're excluded. So I just think it's something that we're, you know, because we have a little time on the agenda, I do think it's something, we're not going to solve it here today, but I do think, I just wonder, I want to hear from you, the rest, all of us, like, are you thinking about it? Are you scared? Are you seeing an impact in your own places of employment and neighborhoods? And
as far as for our organization, so it's every meeting I go to, that's the discussion that's happening.
Okay.
We've not heard any particular thing. However, I was wondering, speaking back to the Funders Council, to Aaron or yourself, was there a discussion about that? Because they also, municipalities in the county, receive HUD funding, community development, and such, and other federal funds from HHS and to do pilot projects. Did they speak about this at all at the Funders Council, about the impact on them? Because it's gonna roll downhill to us.
was it on their agenda?
There was some conversation about funding. I don't know if this specifically was an agenda item, but this was part of the conversation. And so I specifically, the city of Largo, Pinellas County, and the Pinellas County Housing Authority did comment on the fact that, that things are looking a little bit different. Please don't quote me on this because I might be misquoting Elise, and I don't want to do that, especially on the record. But, you know, it based on what I remember, Elise Minkoff of Pinellas County Housing Authority said that they had to pause some positions. For instance, they were hiring a landlord liaison, and a couple of resident services specialists, that were paused. Again, please don't quote me on this, but Joe Riddle with Pinellas County mentioned, that they are moving forward as usual right now, but he is worried about massive implications for the 26 budget. So those are some of the things that came up during today's funders council.
Because I think as providers, that's going to roll downhill. Because there may be choices. Some of us have programs like AFAP, Prevention Financial Assistance Program. It's out of general revenue from Pinellas County government. And so if some of those dollars are going to be needed to assist in other areas that are funded out, not with general revenue, but at municipalities and counties, they may choose to kind of move a little bit more of those dollars to support their operations at the county and municipality. So I'm glad to hear at least they were talking about it. But as providers, that's the other thing that's on my mind. It's not just the direct federal SAMHSA dollars we get for 988, or, you know, it's the trickle down effect of the impact of the local dollars that we get as well.
Do we even have an update on the NOFA?
On the NOFO from HUD.
Yeah, the NOFA, because we didn't make the original list because we had the extension and we filed it late.
I haven't received that update yet.
That's another, you know, so
Yeah.
if that doesn't happen, our Foley's, CASA, all those who receive HUD funding is going to be delayed.
I'm already normally
Or none.
every year I wait 2, 3, 4 months before I get my contract. All my PSH contracts expired last month and this month. So
I do have an update on that, actually. So HUD has up to 6 months from the extension date. So that's December 4th. And so there's no immediate concern, but the same concern that we all have. So what we should all be doing, if possible, through the advocacy committee, is just getting HUD to pay what's already obligated, which is, you know, these NOFO funds. We'll deal with, you know, later, but it's so important that these get even funded, which if that's on the chopping block, it's a big problem. But there's been no indication they won't be. Again, we're kind of operating as if they will. There's no cause for concern. They have through December 4th, or through 6 months from December 4th. We haven't heard back.
We know that when we applied for the extension, because I don't remember hearing that. And quite honestly, I know we debated on whether to file it or not file it. And I don't know, if I'd known there was going to be a up to 6 month delay, I would have advocated for not filing the extension.
I just asked for information from staff, and what I was just told is HUD has up to 6 months from the extension date. And I can follow up with that just to confirm with you, Kevin.
That would have
Or-
major,
Yeah.
massive implications, not just.
I mean, I don't know
Bad
if
thing.
Foley would continue to fund them for 4 months, potentially 5 months without funding just related to the extension, let alone what could happen to, you know, kind of this broadsword that seems to be being taken to federal funding. So we probably should get, you know, as much feedback as we can about up to 6 months, but what do they think it's going to be? I mean, maybe it will be, you know, the end of February, the beginning of March, in which case we didn't need to hit a panic button. So maybe, Aaron, you guys could try to find that out. I do just think that all of us, no doubt, right, as Mickey said, right, it's a topic of conversation in every room. I'm glad to hear that, quite frankly, and I'm glad to hear that the Funders Council was talking about it. You know, we did our own analysis at the agency that I represent, we're a $25 million budget, 350, FTEs. If worst case scenario were to happen for us, we would go down to about a $7 million budget. About 2/3 of my budget would be impacted. So I'm assuming everybody's doing those exercises. My fiscal year starts July 1. I will be presenting to my board of directors in June 2 budgets. One that is kind of, let's hope best case scenario, everything goes the way it's supposed to go. And, kind of a worst case scenario budget for approval. Because, at this point, it is uncertain is the word that I would use. And uncertainty tends to cause, from a mental health standpoint, uncertainty tends to cause greater degrees of depression, anxiety, and other symptomatic illnesses for people. And I just think that we need to be aware of that.
I wanted to add that the Funders Council did also, there used to be a spreadsheet that the jurisdictions work group did.
Yep.
Funding, and so they are going to start updating that so that local funding will be a little bit more clear. So that is another thing that came out of today's discussion and Funders Council that will hopefully help this group as well moving forward.
Go ahead, Judith.
I was just gonna say that, so St. Vincent de Paul Cares is the largest provider of supportive service for veteran families in the nation, right? So quite a bit of our funding is federal dollars. And we had a brief moment, I don't know if you guys remember when they said they were cutting off federal funding. Remember that day? Right. We all remember that day. So there was like a brief moment when we couldn't get in the system to bill. So yes, it kind of put us in a little bit of a panic. I would agree. So then Michael, so I'm just saying this, that we, definitely I'll reach out to Michael. We need to leverage, his reach. He reached out to Bill Arrakis, and literally by the end of the day, the problem was resolved. We were able to, get in and bill, and we were told that our contracts weren't at risk. So I think that advocacy is really important. The other thing I saw, which I thought was curious, and I don't know if it'll ever come to fruition, but April definitely text you and I, is I saw an article where a DeSantis was looking at review of property taxes.
Correct, I saw it too.
And so for those of us that get revenue generated from property taxes like JWB, that could also have risk.
And I mean, again,
But who knows?
and I'm not suggesting that Michael doesn't have tremendous reach, but our VA, we got something from the VA early in the day saying none of the VA programs are impacted. Because we have a transition in place grant. But I got another email this morning with another version of another interpretation of a court ruling on my Department of Justice. I just think that the best we can do is not freak out and just try to, I mean, April and I are on a thread, and Kevin, you're not even part of that. We were talking about worried about how you guys were doing because of the way your funding works. I mean, I think that we all, I guess the whole theme of the last half hour of this discussion is, do we have these discussions? Sure. Do we prepare the best we can? Sure. Wasn't CDBG due today right?
I think so, yeah.
Yeah, and
Pinellas County or Clearwater or somebody, yeah.
Yeah, and I was like, I don't even know if it's worth applying, and for
So
certain things.
they already said the 800 million hurricane relief funds has been frozen.
Yeah, so it's like, all we're gonna be able to do is just sort of but have these discussions so that we're more informed, so that we can, because staff, people, they want to know if they're gonna have jobs. And it's the world we're in at the moment. And I don't know. I mean, I just feel like, people trying to reach out to people or trying to figure out or have influence in this. it's tough and. I mean, you know, we were trying to have a discussion earlier today about priorities, you know, specific to returning citizens, which was a priority under the first Trump administration. But this isn't the first Trump administration, you know, and so, I don't know, you know, and we'll just keep doing the best we can do. And, you know, and I think we all need to sort of settle into some of the organizations who are part of this, including mine. We might not be here. I mean, maybe I'm being a little dramatic in saying that, but you know, Kevin, you and I've had discussions about insurance, right? And you know, we went and saw Adam Anderson, you know, because he's on those certain committees. We're going to try to keep pushing the best we can and try to be there to support one another. Because I think back of what happened last summer, April, and with Zach, you know, it's like, man, this is tough. And stress can get to us, and we're all trying to just do the best we can.
Well, and you know, we do, you know, Governor DeSantis has released his intentions around cutting, and I can't remember the number, but the word that is important is billions. It's with a B, dollars from fiscal year 26's budget. And so I can't remember the exact number of billions, but 30 billion, 3 billion. It's a B. I'm just telling you, it's a B billion. And so when you think about, well, you know, we probably can't list what is at risk, but we could probably list what's not at risk a little easier. I would imagine that things like roads and infrastructure and bridges and law enforcement and those types of priorities could not or would not be a part of those cuts. But other things, special projects and other things that support the works that we do may in fact be at risk. We were on our trade association meeting today, Kevin and and I mean the forecast is rather bleak. And so, you know, when you think about, you know, the way I would end the conversation, not that we're ready to end the conversation, but the way I would end the conversation is, you know, what I said to my team, you know, is, you know, the paradigm, the crisis paradigm, right? Where there is crisis, there is opportunity. And so I do think that we should be looking for opportunity, if there is opportunity. And so if others, you know, get closed down, how would we step in and fill the gap? If there is new people to be served, like, you know, 70 Afghan families, like how would we step in to fill those? That we need to at least be looking for the opportunity in the crisis on how we might respond, and how we might be ready or prepared, you know, to do that. I do know, for example, that, you know, it's starting to get closer. So staff are reporting that ICE is showing up, for example, at their children's elementary school. CARF suggested that we begin, that we in fact begin drilling. If ICE were to show up in the lobby, what would we do? How would you respond to that? So I share all that to say, you know, that when we have a comment or something that you presented right for Pitt, that we have, you know, people who are living street homeless saying, I'm fearful or I'm worried about ICE. That's what I mean by, I don't think it's too far, like, I don't think it's too far removed for, I think it's a fair fear to say out loud. And quite frankly, I'm proud of them for saying it. But, you know, it's these kinds of things that I think we need to be, I just think that we have to have the conversation. We're not going to solve it, I realize, but that we're willing to have hard conversations about what it means.
The National Alliance to End Homelessness sent out an email today that specifically references the fact that communities are still waiting for fiscal year 24 CoC program funds that were awarded last month, and offers opportunities to contact lawmakers and things like that. And then also references staff cuts at HUD and whatnot. If you would like, I'm happy to forward that to everybody, the whole council. Yeah, absolutely.
I know that was on the news today, HUD. It was on the news this morning that they're definitely looking at cuts to HUD. I don't know what that means. I'll be in California next week at a national conference, so maybe I'll learn something there.
And I think that's an excellent point, Judith, which is, what I've talked to my leadership team about is to say to them, listen, in every meeting that you're in, ask the question. Right? Ask the question, are you concerned? Are there things that are on your radar? Are there things that you're concerned about? Is there anything that you can share with me that I should be concerned about? Is there anything on your radar that should be on my radar? Like, we have to ask the question. We can't be just, you go out here and you look and it looks like everybody's just operating all normally, right? Like it's deceptive somehow. It's like, no, wait a minute, it's on fire. And it feels like it's on fire. And so I think, God bless you, that we, that if we're in spaces like a national conference, that we are in fact asking the questions, and that we are looking to our leaders like the entity that Victoria just talked about, that we're looking to our leaders to give us guidance and direction. I'm sure most of you heard this morning as well that one of the other ones that will be impactful to me in particular is, and probably nobody else in the room, but to me in particular, which is that the Secretary for Health and Human Services has taken a position that antidepressant medication for children is not a good thing, and is directly, contributing to and related to gun violence and school shootings, which is simply not true, I might add, and it's been looked at quite extensively over the years. But in any case, so we are anticipating, right, that the number of children that we have, and we serve 34,000 unique individuals last year at Directions for Living on our mental health side of the house, and of that, about a third is children under the age of 18. So, we now have to take a look at what does that mean, right? What does that mean for children who are experiencing mental health challenges? And as you know, families and children in particular who have untreated or undiagnosed mental health issues, they become at higher risk of things like homelessness, child welfare involvement, and DJJ involvement, criminal justice, law enforcement involvement. All of those things become greater vulnerabilities and risks for people who are undiagnosed and or untreated with mental health. So again, I just don't think it's something we can talk enough about, quite frankly, and I certainly don't think it's something that we can ignore.
And I just actually got some more information that feeds into it about the NOFO. So there was a meeting this week with the Florida Coalition to End Homelessness that they have heard from HUD that there may be a new interpretation of a law that says they can take up to 6 months. And the president has said that he may not have to follow laws. So you are exactly right. So the NOFO paid out initial applications that were impacted by disasters within 3 months. We're hoping extended applications that were impacted, that were submitted by December 4th, will pay in the same timeline. But what we have just been told, and it's new information, apparently because the new administration is looking at the regs and saying, we have by law up to 6 months to pay, which is what they're saying. We don't know if that's indicating that they plan to wait up to then, so everyone may need to be prepared for that. It's never been interpreted that way. It's never taken that long. That's new information from the Florida Coalition to End Homelessness.
Thank you for that, Aaron. Again, what Kevin said earlier, right, is had we known that, which we didn't, and I appreciate your clarification on that fact, is that we wouldn't probably have agreed to the extension. What Kevin just kind of said under his breath is we would have stayed up all night to get it done, despite or in spite of the fact that, we had a hurricane blowing through here.
Yeah.
Because, in December, right, we didn't have any way to anticipate necessarily what would be happening.
Yeah, because that's like putting the whole thing in tier 3.
It
Yeah.
is like literally putting the whole thing in 2-3. It is. Imagine.
The other items, public comment, discussion. Yes,
So I have a great news.
that was gonna be my next one, because since there's a lot of uncertainty and gloom, let's end on a positive, so.
So I worked with some some of you during the hurricanes, we had received, it kind of dropped in our laps, Airbnb.org, spaces, for folks to, be, I talked to them this last week. They have, they're looking at expanding it year round for disasters, for us. So like if somebody's house burned down and they needed a place to stay, it's short-lived. They give kind of vouchers for Airbnb locations for an average, I'll say, of like 8 days. Can be depending on how much it is, how many are in your family. It can be a little bit bigger than others. And so we used it, we housed, we signed up, I think 88 families. I knew due to the impact of the area that at first they just said, just give it to anybody who calls into 211. And I said, well, I think first responders in our community, those who've been up all night in shelters, emergency shelters, keeping people safe, went home, their house was absolutely destroyed. And then our mental health community as well, I reached out to a few folks to have them just specifically for first responders. We had the highest utilization rate, which I think is miraculous, 74% actually utilized it. We had the longest stays of any place in the nation. And they have been working with LA, and every disaster place they've been working with the 211, particularly in that region, and are really looking at ramping it up. So good news for this hurricane season, we will have that opportunity again. And they really like the model of doing first responders first, because we need those firemen, law enforcement, you know, who are helping recover in the initial days. And I just thought it was miraculous that we are in that spot because of there were no Airbnbs available in the original days as well. There was no place for them to go. So it took a little bit for some of them to open. So because they were also impacted here in our area by the hurricane. So I just want to share it was success. Thank you to those of you who worked with us on that pilot. And I'm really excited that we'll be able to have that again this hurricane season. And I don't have anything yet on if somebody's home burns down and needs a place yet. I don't have that information, but that also will be hopefully coming soon. So
I really appreciate you for stepping and leading that and making a huge difference. So many people that are in that stressful time. Thank you.
Yeah, I was one of those people that Mickey reached out to. I was flooded. I had 4 feet of water in my house. We are still not put back together. And Mickey, you know, reached out to me personally to say, do you need one of these vouchers? And I said, I don't think I do. And she said, I think you do. And when you're in crisis, you don't think clearly, you don't know what you need, you know, and so I appreciate you so very much. I can't say enough, right, what it meant to me that Mickey called me directly and supported me and did all the things that she could to just see how difficult it was for so many of us. And here we are now heading into March, and we still aren't put back together. I think most of us have just settled into this is life now. We don't have bathrooms, and we don't have washing machines, and we just simply don't have beds. And so we just have settled in, but it is good to hear, right, that they want to repeat it. Because I wake up every single day worried about, it's called PTSD in case you don't know. But I wake up every single day worried about hurricane season and that we are one day closer. You know, with that, I know Dominique sent something out today. If you didn't get it, Dominique, with the county is going to be holding a debrief and a foreshadowing or something. I don't know what it's called, but it's an in-person meeting relative to hurricane season and, you know, just the overall devastation in Pinellas County in particular, our barrier islands as well. But if you didn't get that email, maybe Victoria, you could send that out to everybody. I do think you have to register for it. It's an in-person meeting, but I would encourage so many of us to be there.
It is an in-person meeting. It was also included in the providers newsletter that went out earlier this month, in case anybody got that but didn't get Dominique's email. This is Monday, March 3rd 1 p.m. to 3:30 p.m. at the Pinellas County EOC, which is 10750 Omerton Road, also here in Largo. Please arrive by 12:45 to allow time for security. But we can absolutely, I just forwarded the NAEH email, and I can go ahead and forward this one as well, just to make sure that everybody has it.
Isn't it true that it says that you need to register, for it?
You do have to register. I actually, Megan and I have the registration set up, so I'm looking at those and forwarding them to Dominique as they come through. So, yeah, let us know if you have any questions, or if you have any trouble registering, we're happy to help with that.
That program helped several of my staff that lost their homes during the storm. And quite honestly, they wouldn't have been able to come to work or to function or do anything without that. And because of that, they were able to. Extremely grateful that it provided them a little bit of that stress relief and time to sort some longer term plans out. I'm glad to hear that it will be available.
I know, so it's excited.
I have a happy announcement. Also, you guys may have heard, Metropolitan Ministries is partnering with St. Pete Free Clinic, and we're opening up a family shelter starting in July. So I'm super excited through that amazing partnership. We're also partnering with the YMCA for childcare for the children. They'll be living in the shelter, and we're kind of in the initial phases of determining all the aspects of the programming, but we will have room for 22 households down in the St. Pete location. We'll also are leasing from them their Lealman property, which we'll be using for low cost rental. So we're going to be able to really help about approximately 30 units in Pinellas County through the partnership.
Congratulations.
Thank you.
Yeah, that's awesome.
Judith, did you have good news?
I do. I have good news.
Yeah.
So we got reaccredited by CoA. And it's expedited accreditation, which means we were super good. And our Center of Hope is accredited. It wasn't part of the accreditation in the past, but now our shelter's accredited.
Fantastic,
wonderful.
great job.
That's wonderful. Yeah.
We'll be opening up 15 units of housing next month, so I'm excited about that. And we start construction next month on 17 more. So it's good to, especially with all the housing loss, to be able to add some too. Yeah, good news, public comment. Online, anything online, good news, comments?
Oh, your art show.
My art show.
Isn't it home? Am I confused? Oh, there's an art walk.
Oh, yeah, we have art walk at the Tully.
Got some things on his mind.
Too much going on.
I was confused for
Tully
a second.
Main Gallery, in St. Pete, so, yeah, we really, art, and, we've certainly found that, population art is a great form of, expression for them, so, yeah, gosh, now it caught me off guard. I don't have
It's okay,
to
Megan has the flyer.
There's the flyer. Okay, so we did this last year. It's our first time doing it, so they get to put their art in the gallery, show off and sell their piece, establish their pricing for it. And so we're excited by that. And while I'm on it, year 4 of Foley Centers on Broadway is confirmed too. So we are just started that campaign yesterday, actually. Unspoken Realities there. Thank you. Saturday, March 8th at the Tully Levine Gallery in St. Pete on 22nd Street South. Come check it out. Just come see the amazing artwork. And if you like something, buy it. But yeah, Foley Centers on Broadway will be in May 22nd, 23rd. Location, hopefully Eckerd College in their theater. I'm still fine tuning the details on it, but this year we will be doing The Wedding Singer.
Oh, that's cute.
Should be a lot of fun. As more details come, I'll send them out.
I want you to do Footloose.
Oh, that's a good one.
Good.
Let me put that down.
But
We were gonna do, what's the one that's showing right now?
Wicked.
No, I think it's at the straws. Not Wicked. That would be good too, but
I don't know.
it's a licensing thing, you know, so when you go to apply for it, if it's showing anywhere in the area that you get declined, and so sometimes it shuts down your process, so we ended up with the Wedding Singer, which should be fun. I've never seen the musical of Wedding Singer, so I hear it's very good.
Kevin, actually, I have one more request or comment, if you don't mind.
Hey, go
This is
ahead,
Aaron. Yeah, so as everyone probably knows, there's been some press and St. Pete Catalyst and some stories with Commissioner. I just ask if anyone has comments or questions. There was a statement made in an interview where the words bad intentions were used. And I think it should be crystal clear that not a single person, entity, provider, funder within our entire continuum has any bad intentions with any money. And I don't think anyone should be using those words, and that narrative should be not used. But I would say those words hurt some people, hurt some staff, and I don't think that's fair. So I would just ask anyone within this room, leaders, to help change that narrative, because that's certainly not true. I don't think anyone has any bad intentions, and we can really help shift the narrative that we're all working together to reduce, homelessness. We're all fighting in the same boat. All these good news stories prove that. And I would just ask that to help protect staff members who can be hurt by some narratives that, while everyone can improve, while we can all work better together, just that can hurt, and in particular. So let's kind of help change that, if I can make that request.
I mean, it sounds like you're suggesting someone that you know of has used that language. I'm
It
not
was
familiar
it
with
was
what you're
Commissioner
talking
Nowicki.
about.
Oh, I'm sorry, April. It was Commissioner Nowicki at the last commissioners meeting, when he was specifically speaking about the HLA, said that maybe we're using funds with bad intentions. And he was speaking about funds that are county funds that we have nothing to do with. And I think he got that intention or those thoughts from the last membership meeting that he attended. And that story prompted a follow-up story, well, actually two follow-up stories that were then on 10 Tampa Bay and Bay News 9. And I just think that narrative is unfair, because any funds that come into the HLA, generally would go to any subcontractor. So no one has bad intentions. And no one in this room used those words. I just would ask anyone, who's asked about that, or just we're all working together, and no one certainly has bad intentions. And I would just ask, again, the leaders in the room, anyone here, to help us change that narrative, because those words can hurt.
Sure, I would encourage you to reach out to Commissioner Vince Nowicki and have that conversation directly.
We have, and will.
Yeah, okay.
Yeah, and I think, I'm pretty sure his onboarding, was done yesterday, and my hope is in that onboarding process, he was a little bit more informed on the nature of our funding and our process, because I know he's very new to this arena and space.
Yeah, just trying, protect my staff, especially when it was, on a newscast. And I just think that specific words were unfair, and I want to just help, especially my staff on this call, even make that known. So thank you.
Comments? We are a couple minutes left. All right, hearing none, call for adjournment of the meeting.
Motion to adjourn.
Second. Aye.
Aye.
Have a great weekend, everyone.
Keep our Michigan coat on.
Be ready for the snow out there.